Very cool.
Hey, as COVID cases continue in our community, so does the need for COVID convalescent plasma, or CCP. Versiti Blood Center is pleading with those who have previously been infected with COVID to help others by donating that plasma.
And to learn more about when, where, and why you should help, we're joined by Dr. Dan Waxman, VP of Transfusion Medicine. Good morning. Thanks so much for joining us.
Thanks for having me.
Absolutely. So let's talk about this. Why is it so important to receive this CCP?
Well, it's a therapy that we can't make in a laboratory. This really needs to come from people who've recovered from COVID-19. They have antibodies that we test for, and then we have them donate plasma, which is a very easy procedure, takes 30 to 40 minutes. You're on a tabletop machine that you're just connected to with one arm, and in 30 to 40 minutes, we will create 3 to 4 plasma products that can be used for therapy for these patients.
That's phenomenal, but the one part that stood out for me is you said it cannot be synthesized. You cannot make this any other way, right?
Right. This is called passive antibody therapy. It's not a new therapy. In fact, this was originally done 100 years ago in the Spanish flu pandemic, and it's been done through the years. But this is the first time, I think, on a worldwide basis, this therapy is being done. And right here in Michigan, we have over 50 donors a week who are donating, and they're creating some, almost 200 products per week. But these products are going right out our blood center door to the hospitals to treat patients in the hospital.
Well, and I actually know many people now who have had COVID and actually done very well. They've come out fine. But what's the demand like out there for this? Are people stepping up to do this?
They are, but as we find more people who've been exposed to COVID-19 and have a documented test, we really need them to come and be donors. This is something they can do today to help patients right now in our hospitals. And it's a therapy, again, we can't create it in a lab. This is coming from people who've thankfully recovered from COVID-19. Also, all blood donations now. If you come in and you're a regular blood donor, or donate platelets, we're testing all blood donations for COVID antibodies. So we're finding quite a few people who have antibodies to COVID-19 who never knew they had been infected, and they can then become CCP donors.
Absolutely. I bet you're like, hey, why don't you stay here for an extra half hour? Because we just found something out, right? So we know, who can donate. So if you've had COVID, is there a time period you have to wait past your recovery to donate? How many times can you donate? How often can you? So many questions.
Yeah, excellent. So you have to be symptom-free for at least 14 days. We do a pre-screening, and people just need to go to versiti.org/COVID-19 plasma. And you go to this and you can learn about becoming a donor. Once we screen you and clear you to be a donor, you can donate weekly, and you can donate up to 12 times. So we've been doing this almost a year now. We started actually in April of last year, and we have had people donating up to 12 times weekly over 3 to 4 months. And they've been able to have a true clinical impact on a number of patients. Because again, every time you donate, we create 3 to 4 products. And when we treat patients in the hospitals, the patients get 1 to 2 of these plasma products. And it's a transfusion. And so we get to treat patients, and we get to have donors right here in our state. And it really is having a clinical impact and helping people recover from COVID-19.
So many of us have been sitting at home for almost a year now, thinking, wishing there was something that we could do, to make this go away, to end this. So if you have recovered, obviously this is it. I mean, they can't make it in a lab. Your body is the only place they can pull it from. So if you want to have that effect, how do people, I'm assuming this is by appointment only, or do you just walk in? How does it work?
Well, it's for CCP donors, it's appointment only, and because we really need to schedule a time. We have these apheresis machines that are to do the collections, and so we need them to go to the website here and make an appointment. But for all other blood donors, every day we still need blood for patients who are undergoing surgery, people who have cancer. We need blood and plasma and platelets for our regular patients. So if you haven't had COVID-19, that is great. But we need you to be a regular blood donor too. And so if you just go to this website or versiti.org, if you're a regular donor, we do take walk-in donors for regular whole blood donations. But for CCP donors, we really want you to go to this website and talk to our folks, and we'll get you to come in. And again, it's something, if you've never been a blood donor in your life, this is now something that you have that patients need.
All right. With that said, thank you so much for your time this morning.
Thanks for having me.
Absolutely. Want to learn more? Again, the website, versiti.org/COVID-19 plasma.